Philippine Council for Health Research Development Executive Director Dr. Jaime Montoya says the mass vaccination of Filipinos for COVID-19 may start in the second quarter of next year, either June or July. Dr. Montoya made the statement during this morning's Laging Handa public briefing. According to him, the government continues negotiations with suppliers of vaccines from various countries. A tripartite agreement was earlier signed with British drug maker Astrazeneca, as we hear from Kenneth Pasyente.
After the Philippines signed a tripartite agreement last Friday with the private sector with regard to the possible rollout of an Astrazeneca vaccine against COVID-19, the DOST Philippine Council for Health Research and Development clarified that it will still undergo a long process. This to ensure the efficacy and safety of the vaccine. In fact, Dr. Jaime Montoya, Executive Director of the DOST PCHRD, said that AstraZeneca already signed a confidentiality data agreement that allows the vaccine expert panel of the Philippine Food and Drug Administration to study the data it will submit with regard to the Phase 3 clinical trials the pharmaceutical company plans to conduct in the country.
Ito po isang pagkakataon para ma-verify rin natin kung ano po man yung mga katanungan na binibigay sa kanila ng press at ng iba't ibang tao po tungkol sa resulta na kanilang Phase 3 clinical trial.
And since it will take some time, Montoya said that data from the clinical trials of AstraZeneca should be analyzed before questioning the effectivity and safety of the vaccine. Health Secretary Francisco Duque III, on the other hand, said that since it is still only an agreement, the government has not yet paid any amount to the British pharmaceutical company. The Secretary also asserted that the public need not worry that the administration joined a tripartite agreement with AstraZeneca even if it doesn't have an emergency use authorization or EUA. Duque said the agreement will still undergo stringent evaluation and review.
Nakapalingin po naman sa agreement na yan na talagang susunod po sila sa lahat po ng ating pamantayan at panuntunan ng DOH.
The Health Secretary also added that the agreement may be voided if any of its provisions are violated.
Meron tayong mga obligasyon under the agreement, ang national government, ang private sector, at ang vaccine manufacturing companies.
Kenneth Pasyente for The Nation.